Let's talk about one of the most common concern in a man and a woman life is hair fall. Today we are going to talk about hair fall, its causes and treatment involved to it. Hi everyone, I'm Dr. Radha Sharma. Today we are going to discuss about hair fall and its treatment. Why it happens, why it is the most common problem and increasing nowadays a lot. Hair fall, if you're noticing, you need to first see whether it's a diffuse hair loss or a delayed area that is involved or localized hair loss. When we talk about diffuse means you might see that thinning, and that is a gradual thinning, not a sudden. So if you're seeing that there is a gradual thinning over this area and the sides of your hair, you definitely are going towards the patterned hair loss. When you're noticing some area which is localized and do not see, it's a clean area of hair loss. That is known as alopecia areata, and it is an autoimmune condition that sometimes resolves its own and has treatment also in and around if it doesn't go off in 2 to 3 weeks of time or maximum 3 months. Coming down to diffuse hair loss, that's the major problem and has lot of treatments are available for that and very difficult to treat as well. Why diffuse hair loss is a major problem and a concern in a treatment part also, because it has a strong association involved to genetics also and internally your hormone as well. These are the most common causes involved. We talk about genetic involvement, you need to see how the family pattern of that particular patient is. You need to see how the parents and the siblings are going towards the hair loss. That's called as patterned hair loss. Even it is most commonly seen in generation to generation. Whenever you talk about any internal causes, that can be your hormone, that can be if you are on certain medication involved, your lifestyle, stress related, your sleeping patterns, all of that involved into hair loss. Some investigations that are involved in hair loss are your hemoglobin levels in reference to your iron, then your thyroid, then your vitamin D and B12 levels. These all first should be checked before we put you on any treatment, because we need to treat such fulfill or do something about such deficiencies also. Treatment part of hair loss involved, first and foremost, it is a very regular religious treatment. If you're thinking to go for any treatment related to hair loss, you need to be regular, religious, and it's a long-term treatment. When I talk about long-term, it will involve months to years treatment and prevention and certain hair care thing that is involved almost for throughout your life if you want to maintain your results. Treatment involves certain medications and in clinic treatment also. Medications involve your minoxidil starting from 2%, that is for female, 5% and 10% for male. Medication involves certain biotin and amino acid supplements and your finasteride as well. These are the medications should be taken under dermatological supervision. Ever since that minoxidil has come to picture, because minoxidil has a lot of restrictions. There's a new drug that has come up is Redensil and Procapil. They are still under a FDA approved regulation, but they do not have any side effect when it comes to minoxidil. It has few side effects like can increase your dandruff. Some people have noticed headache around minoxidil, because you're supposed to use minoxidil for years and years when you're starting your hair fall treatment. So always be careful with the medication that you start for a hair fall. Always consult your dermatologist if you're starting any hair fall treatment. When we talk about in-clinic procedure, there can be laser therapy which involve low-lying laser hair stimulation therapy, your mesotherapy, that is micro injections of certain hair supplements, and PRP and growth factors. Growth factor is the most recent treatment that involved. Growth factor concentrate, we call it. In that, we withdraw your own blood, centrifuge it, prepare it plasma that is rich in platelet and inject into your hair follicle. That further enhances your hair follicle activity. It rejuvenates your hair follicles. It helps them to recover from the damage they are into, and it's a beautiful treatment when we talk about increasing your hair texture, density and all. So always make sure you talk to your dermatologist about these treatment and get the right help. Thank you.